as a county government of Migori, we set health sector as our priority, having known that a health people is very important to us. Therefore, as a county government, we continue investing to ensure that we provide quality services to the people of Migori, and also ensuring that we are taking health care services closer to the people. We are committed as a county, and also working closely with our development partners in establishing health services close to our people. Sickle cell disease is a concern. It is estimated almost 6% of the total population across the globe, people suffer from the sickle cell disease. When we come to Kenya, it is approximated that over 14,000 children are born annually with the sickle cell disease, and most of them we realize they die before reaching the 5th year of their birthday. So it's a main concern for us as a county. Sickle cell disease is among the diseases that are non-communicable diseases that contribute to the most high mortality rates in Kenya and in Migori. We realize in Kenya, the mostly affected areas are the lake region, that's the Nyanza region, western region, and the coastal region, basically along malaria endemic zones of our county. And we realize that because of this, it makes us a concern on how can we support and help our people, especially those who are much affected. And we realize most of the people in this county that are more vulnerable and poor people. And we find treating sickle cell disease is an expensive affair, because it really is the treatment and management. It's a training experience for the people because it requires finances. Accessing sickle cell drugs is not easy, especially in this region, because of the high cost. The other thing is about the food, the nutrition. When you have a child who is suffering from the sickle cell disease, they require special food that has good nutritional value, and sometimes they require supplements that helps to go. You'll find that sometimes sickle disease, they need immunization, and these also require finances. In this region of Nyanza, the hospital that is specialized or has the main hospital is the Jaramogi Oginga Hospital and Referral Hospital in Kisumu. So it is quite a distance from, especially from Migori, people seeking special treatment. And that's why we are feeling that if the services for sickle cell diseases are brought closer to the people, we are going to support and help more people to get access to this treatment. It's also, most of the families can't afford this treatment. Therefore, that's why we are working closely with the development partners, and also requesting more development partners to come and work closely with the county government of Migori in supporting, in helping these vulnerable people who cannot afford to seek medical treatment for their children. We, as county government, we are partnering with the Journey by Grace mission from the U.S. To conduct a medical camp. And this medical camp is going to be an avenue, to give us an avenue to create awareness to our people, and also provide services and necessary for the sickle cell patients. One of the main reasons of this is also providing the information to the people, because some of the challenges that the families, the children, and the people who are suffering from the sickle cell is about the myths surrounding the sickle cell. Some of the people believe is a curse for the children who are born with the sickle cell, because they believe it's like a ancestral curse. The community believe it's it's witchcraft, that you have been bewitched and all that. And you will find that this is something the families, the children have no control, because sickle cell is inherited from their generation. Therefore, this medical camp will serve as an avenue to provide information, to create awareness, and also support the families, the children who are currently on medication, and also will be doing screening. We'll be able to provide other services like the critical or the common diseases in this region. That is treatment of malaria, treatment of common infection into diseases such as respiratory, malaria treatment, typhoid, and all that. Therefore, we will want to request, invite most of the people to attend this medical camp. We'll be doing a medical camp at Kehancha. We will have to have venues, one at a cereal ground, Kehancha, and also we have a private clinic there which have not been launched. So they have given us a venue to conduct the medical camp. And I want to talk more also about the coming up of the sickle cell in this region, the sickle cell hospital in this region. When I went to the US last year, I had a discussion with the Journey by Grace mission, and also had a discussion with Manate Hospital in Florida. The CEOs and the doctors, we signed an MOU that we'll be collaborating with them. And it's out of that the Journey by Grace, we agree that we want to establish a sickle cell hospital in Kehancha, and we'll be launching that hospital on 20th. This is a huge investment that will require support from many people, because we want to make it a specialized hospital that is going to serve the people in Nyanza. That's this region. It will serve the county of Migori, it will serve the county of Kisi, it will serve the county of Homa Bay, and it will serve the county of Nyamira, because they are close to this region as compared to people traveling to Kisumu to seek their treatment there. I therefore request that anybody hearing me, we need your support, we need your collaboration. Our development partners who are working in this area, I want you to join hands, support Journey by Grace, support the County of Government of Migori in establishing this hospital. It is going to serve many people. It's going to serve the needy people who that need these services dearly. Because if we don't help them, most of the children under the age with the sickle cell traits, they may die before reaching their 50th birthday. So therefore, by you putting a hand in this, is going to support and give a life to these young people. Now, I want to encourage the parents, especially those who are having children with sickle cell, that this is not a life-threatening condition. It can be treated, it can be handled. I remember when I went to the US in Florida, I met a man who had lived to 50 years with sickle cell. Therefore, the children have a chance to live to their fullest life if they're given proper care, proper treatment, proper management. Therefore, I want to ask the parents, never give up in supporting your children, never give up out of pressure, but it is important and worthwhile to sacrifice for that child to live to his fullness. sickness have no boundaries. I know there are people moving from Migori to Kisumu seeking health treatment, people going to Nairobi. Therefore, this initiative for Migori, that it requires support from our neighboring counties, that this facility is going to support our people, it's going to serve them, it's not going to be a Migori thing. I know even the people from Tanzania will be able to be served from this hospital. Therefore, it is a collaboration, is an initiative that needs the support of the South Nyanza region support. You know, sickle cell is one of the, I can say it to my assessment, some of the neglected diseases across. And losing even one life is a loss. Is therefore, by us saving even that one life, by saving that percentage of people who die, who can't get service, is very important to us as a county government, because everybody deserves to get those health services. Everybody deserves to live to his fullness, because that is our work. That's the mandate that people of Migori gave us. So we'll do anything if we can save a life through establishment of sickle cell hospital, through our development partners. Very important for us.